Turning to coronavirus in Alabama, the state feeling the full impact of the Thanksgiving holiday. More than 1,900 new cases were confirmed today, pushing the state total to over 244,000 cases, resulting in more than 3,600 lives lost to the deadly virus. The state health department also reporting more than 53,000 cases as probable, awaiting confirmation.
Hospitals across the state preparing for the worst. Over 2,200 patients being treated for the virus across the state. Here's a look at the hospitalization trend for the past week. These are record-breaking numbers for our hospital systems.
Today, Alabama's Alcoholic Beverage Control Board reinstituted curbside alcohol sales. The approval came at an emergency virtual meeting today. The change is due to a surge in COVID-19 cases. They made a similar move in March to allow businesses with liquor licenses to sell to-go alcohol in unopened containers when bars and restaurants' dining rooms were shut down. Douglas Brown, the owner of Back 40 Beer Company, says that he's thankful for a chance to serve more customers through curbside and takeout services.
The timing is really good for us because we're just now this week starting to can out of this location. So we'd be able to take our canned beer out if somebody wanted to order it and pick it up for a holiday gift or what have you.
Curbside pickup and takeout ends on January 4th. The new order does restrict the amount of alcohol that can be sold per customer.
UAB playing a major part in rolling out the vaccine here in central Alabama. The health system expects to start administering the shots in the next few days. WVTM 13's John Papke takes a closer look how the long-awaited vaccine distribution will play out.
A sight the nation has been waiting on for 9 months. Boxes of COVID-19 vaccine shipping out. Alabama received its 40,000 doses today. UAB could get its 10,000 tomorrow. But it will be a few days before the life-saving shots start.
Taking vaccine from the freezer to a syringe to inject in someone's arm is a lengthy process.
There is a strict pecking order for the first batch of vaccine. Half go to select EMS, doctor's office, and general hospital staff, while the rest are for the frontline hospital workers.
This vaccine will be prioritized for healthcare workers in both the hospital and outpatient environments and for EMS providers.
UAB experts say that Alabama's rural counties have some of the highest coronavirus infection rates based on their population, and many don't have the facilities with the capacity to freeze the Pfizer vaccine at 80 degrees below zero. But we're told the state does have a plan to get the vaccine to all nursing homes, no matter how remote.
I believe if there were to be a gap, if you're in a county where there's neither of those kinds of pharmacies, then they will work around a way to get the vaccine to the nursing homes.
The general public will have to wait a few months before their vaccine is available, and UAB warns we still have a long fight ahead.
The vaccine is not going to stop the surge that we're experiencing now. It won't be available in quantities sufficient enough for us to stop this surge right now.
But today's vaccine arrival helps the light at the end of the tunnel shine a little brighter. John Papke, WVTM 13.
More than 244,000 people in Alabama had or have coronavirus. If that's you, you might be wondering if you'll need to get the vaccine. The answer is yes. According to Jefferson County Health Officer Dr. Mark Wilson, if you've had COVID-19 and recovered, you've essentially built up some immunity to the virus, but that ends and you will need the vaccine. So keep in mind, immunity does wear off, and although rare, there are instances of people who get the virus for a second time. More testing available in central Alabama, the most recent in Oxford. A drive-through site will be held at the Oxford Civic Center tomorrow. Testing is free if you've been exposed to the virus or are showing symptoms. The event will be held from 10 in the morning until 2 in the afternoon.